Everyone, today we'll be talking about when to get pregnant after a miscarriage. Thinking about pregnancy after a miscarriage, you might be anxious or confused on what caused your miscarriage and when to conceive again. Today's video will be telling you on how to get pregnant after a miscarriage, when to conceive, and how to have a healthy pregnancy again. Pregnancy after a miscarriage can be stressful and confusing. What is the best time to get pregnant again? What is the odds of miscarrying the pregnancy again? If you're interested in those facts, get them in this video. Sit and watch till the end. Share the video. My name is Dr. Adazion. I'm a consultant obstetrician gynecologist. Subscribe to my YouTube page at Dr. Adazion at OBGYN Talks with Dr-Adazion. Follow me on Facebook page, Instagram, and TikTok with the name OBGYN Talks with Dr. Adazion. I discuss everything about women's health, children's health, and sometimes men's health. Share this video right now. Miscarriage is said to occur when someone loses her pregnancy before 20 weeks gestation. However, depending on the salvage rate for different countries, miscarriage is said to occur when someone loses her pregnancy before the age of viability. In the context of where I practice, which is Nigeria, the age of viability for Nigeria is 28 weeks. So when someone loses her pregnancy before 28 weeks gestation, that is 7 months pregnancy, the person is said to have had miscarriages. So there are different causes for miscarriages. Those miscarriages can be divided into first trimester miscarriage, when it happens between conception and 12 weeks gestation, that is 12 to 13 weeks. Now, second trimester miscarriage from 13 weeks gestation, that's about 3 months to 7 months. That's second trimester miscarriage. We are using miscarriage because it's before the age of viability. However, someone can have subsequent pregnancy losses after age of viability, that is from 28 weeks to before delivery. So but we're focusing on miscarriage, which is before the age of viability. So when someone loses her pregnancy before the age of viability, the person is said to have miscarried that pregnancy. It can be divided into first trimester miscarriage, second trimester miscarriage. Where it's divided into so is because there are different causes for each of the trimesters. For first trimester pregnancy losses or first trimester miscarriage, the following are the causes. The commonest cause for first trimester miscarriage is chromosomal abnormality. The chromosome is what is in the DNA, is the structure, is what forms the fetus, the baby. So if there is any abnormality in the chromosome, either during translocating the chromosome from the man to the woman into the baby, or during the building up, whatever that causes abnormality in the chromosome can lead to miscarriage. More than half of miscarriages that happen in first trimester is from chromosomal abnormalities. Now, the second commonest cause of first trimester miscarriage, that is before 3 months, is placenta problem. When there is issue with the placenta, the placenta getting built up, getting implanted, if there's any abnormality in the placenta, it can lead to first trimester miscarriages. There are other risk factors in a woman that can lead to first trimester miscarriage. Someone that is smoking is at risk of miscarrying her baby. Someone that is heavily on alcohol can cause miscarriage. Someone that takes caffeine so much is also at risk of miscarriage, first trimester miscarriage. Someone that is obese is also at risk of first trimester miscarriage. Advanced maternal age greater than 35 years. You know that with advanced maternal age, there's also increase of chromosomal abnormality, and so the woman is also at risk of first trimester miscarriage. Also, the use of illicit drugs, recreational drugs, can also cause first trimester or even second trimester miscarriages. Now let's go to second trimester miscarriages. Second trimester miscarriages means when a woman that is pregnant miscarries from 3 months of pregnancy to about 27 months of pregnancy. So this is second trimester. Now, when someone miscarries her baby during this period, the commonest is usually cervical incompetence. Cervical incompetence means that the cervix which is the mouth of the womb, it's not capable enough to hold the pregnancy. So as the pregnancy is advancing, it is trying to give way, and it continues to give way until it begins to dilate and the baby is pushed out. So cervical incompetence is one of the commonest causes of second trimester miscarriage. Then another is uterine abnormality. If there's any abnormality in the uterus, it will show, because the uterus will not be able to expand more to take that pregnancy, and so at that second trimester we will try to push it out. So some uterine abnormality like septate uterus, biconate uterus, uterine diaphy, some of these abnormalities, I've mentioned it in my previous video, you can check them. These can cause second trimester miscarriage. Other causes include huge uterine fibroid. If there is fibroid occupying the endometrium, this we call it submucous fibroid. Fibroids are different. So if there's a huge uterine fibroid occupying where the baby stays, that is the endometrium, we call it submucous fibroid, or even intramural fibroid, anywhere they are, so far they are compressing space with the baby, that baby may be pushed out and the person will present with second trimester miscarriage. So any huge mass, example uterine fibroid in the endometrium, struggling for space with the baby, will likely push the baby out and the woman will present with second trimester miscarriage. Others include poorly controlled diabetes in pregnancy. When someone has elevated blood sugar that is not controlled, the baby will have some abnormalities, and the way nature takes care of that is to push the baby away so that the woman may not suffer. Then the third is poorly controlled hypertension. If there is elevated blood pressure in pregnancy that is not controlled, there will be decreased uteroplacental flow. The blood supply to the baby through the placenta is impaired, even oxygen supply, and so the baby may die off and will lose as miscarriage. Others include some use of drugs. There are some drugs that is not supposed to be used in pregnancy. For example, misoprostol, methotrexate. These are drugs that are used in ulcer patients for protecting their GIT from the ulcer. So people using these drugs and they are pregnant, those drugs have effect on the uterus. They will contract and push out the baby. Methotrexate, some other drugs that are not convenient. So before you use any drugs in pregnancy, you should confirm and discuss with your obstetrician. Then others include infections. Some infections in the baby or in the woman, like toxoplasmosis. Some of these infections can cause miscarriages. Now, for other ones include autoimmune diseases. There are some autoimmune diseases in the woman that may affect pregnancy and will give the woman increased risk of miscarrying. These are just few of the things that can cause others. Let me not just forget polycystic ovarian disease. Polycystic ovarian disease, remember, is one of the causes of infertility. However, it has been associated with increased risk for miscarriage in women that have it. So antiphospholipid syndrome is also another cause of second trimester miscarriage. So when someone is pregnant and comes with this, we try to evaluate and find the cause, especially in second trimester. We'll not be going on to talk about third trimester. We'll discuss it in another video. So these are the causes of second trimester miscarriages. If you have watched to this point and you have not subscribed, please subscribe to my page at Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Follow me on Facebook, TikTok, and on Instagram with OBGYN Talks with Dr. Adazion. Hit the notification button, share the video now. Now let's go to when to get pregnant after a miscarriage. There's no consensus on when to get pregnant after a miscarriage. However, we'll consider some things before we counsel someone to get pregnant after a miscarriage. Number one is the healing process, whether the person has healed properly. Miscarriage is a loss of pregnancy, and some couples react differently to the grief. We call it grief reaction. So some heal faster while others don't. So getting healed, healing process following a miscarriage can take some time. We'll consider whether the person has totally healed and whether the person has grieved over the pregnancy loss. Now we'll consider the cause of that pregnancy. Is it something that can be treated? Is this something that will not be treated? Is this something that is modifiable or not modifiable risk? So that the person will not have another repeat miscarriage. A miscarriage can be a traumatic experience. So you may need to spend some time grieving the loss before moving ahead with another attempt at pregnancy. Getting emotional support from a qualified mental health professionals can help you with your emotions. Even getting support from your partner and those around you can help you with your emotions so that you can feel confidently when entering into another pregnancy. When to get pregnant after a miscarriage is a personal one. Some medical professions have agreed that you can get pregnant within 1 month to 3 months after a miscarriage. WHO has said sometimes that you can wait for 6 months. However, the choice of when to get pregnant is your own personal choice. So far, you have healed from the previous loss, and there is the grief reaction, you have passed through it, and you are strong to go into a pregnancy. Sometimes we recommend that you wait for your next menstrual period to come so you can get pregnant, so it will be to help us to date your pregnancy. That's one of the reasons why we asked you to wait till after about your next menstrual period you can now get pregnant. If there are some medical conditions that caused that pregnancy, we advise you to wait longer. Why you have to wait longer? So that the medical conditions can be corrected, so that you don't go on to have another repeat pregnancy loss. Things like incompetent cervix. When your cervix is not competent enough to hold the pregnancy, we ask you to wait, we'll evaluate you and find out that truly you have an incompetent pregnancy, so that when you are getting pregnant, we are watching over you. If you pass your first trimester, we go on to put what we call sacrilege to hold the cervix so that you don't lose the pregnancy again. Some other conditions like uterine abnormalities, you are evaluated and the cause treated if possible. Then other things like uncontrolled diabetes, we ask you to wait a little, let the diabetes be controlled, and when it's controlled, you are allowed to go and get pregnant. Uncontrolled hypertension, the same thing. Neurological disease in you can be treated. However, modifiable risk factors like intake of alcohol, intake of illicit drugs, intake of high dose caffeine, all these smoking, things that can lead to miscarriages, we tell you to avoid it. You stop them and you go on to get your pregnant. So there's no real consensus on when to get pregnant. Some people have gotten pregnant even within 2 weeks before even seeing their next menses. However, dating becomes difficult because the menses has not come for us to get accurately when you took in. So if you have healed totally and you are strong enough to get pregnant again, you can go on to get pregnant after your first period. So when you have lost a pregnancy, we advise that you go on and wait. At least let the first period come. When your first period has come, you can go on to try for another pregnancy. Sometimes the pregnancy does not happen, but if you persistently continue to try, within 6 months you will be able to get pregnant. If after 6 months you have not gotten pregnant after a miscarriage and you are above 35 years, you are advised to seek a medical care with your gynecologist and with your doctor. Now, we also advise that if you have those modifiable risk factors, you avoid them as much as possible. If you have medical conditions, they get treated. With time, as we are getting treatment, it may take some time before you get pregnant. Now, how do you prevent another repeat miscarriage? Prenatal care. You have lost a pregnancy. We advise that you have as much as possible prenatal care before you take in again. In your prenatal care, you'll be placed on folic acid. The benefits of folic acid before your next pregnancy cannot be overemphasized. It helps you stop some abnormalities that might have occurred in your previous pregnancy. So you take folic acid as much as possible before your next pregnancy. So some women are placed on folic acid about 1 to 3 months even before they get pregnant again. If you have some medical conditions, you're also placed on this folic acid before your next pregnancy. We also advise that you avoid smoking, avoid use of illicit drugs, avoid alcohol, manage your weight as much as possible, eat healthy, and avoid every other risk to infection so that you will not have a repeat miscarriage. The choice of when to try to become pregnant after a miscarriage is a personal one. There is often no medical reason to wait if you don't want to wait, except if otherwise stated. Thank you for watching to this point. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. Subscribe to my page at OBGYN Talks with Dr. Adazion. See you next time for another enriching video. Thank you. Share this video right now.